Today is a special day because we are talking about hormones. I am on my own journey of balancing my hormones right now, and because of trauma and the things I've gone through in my life, they were a little out of whack. I'm so happy to have my provider, who is incredibly knowledgeable in this subject, Carolina Jones. She is the owner of Vital Advanced Medical Center here in Tampa. So thank you, Carolina, for enlightening all of us about hormones. This was one that I was so excited to share because I knew this was going to be so educational to many women, especially those who've been through trauma. So why don't you go ahead and tell us what you do and how you got into this world of hormones?
Yeah. That's a loaded question, Dana. So again, my name is Carolina Jones. I'm the owner of Vital Advanced Medical Center. I'm a family nurse practitioner and a hormone specialist. So I've gone through extra training to make sure that I understand hormones on a very intimate level so that I can help my women. The reason that I got into hormones is because a few years ago, I had rapid weight loss. When you lose weight rapidly, it's actually a traumatic event to the body, and it causes almost like the stress response, and it forced my body into premature ovarian failure. So I ended up going into early menopause because of the rapid weight loss. I'm definitely happier at this weight. I'm happy to be this small and everything, but I didn't realize kind of the impact it was going to have on my hormones until after the fact. So when I went into early menopause, I experienced all the things. I had, vaginal dryness, low libido. I was really tired. I had brain fog, loss of memory. I just did not feel like myself.
Yeah.
My muscles felt really weak. I didn't want to get out of bed. It was just a really kind of dark time in my life. And of course, I had no cycle at the time. So I looked at my hormones. I got them checked out. And I remember my provider, funny, she said, "Oh, Carolina, your hormones are like a 65-year-old lady." And I was like, what? It made me sad, but also was like, wow, like there really was something wrong. Like I wasn't just making this up. It wasn't just being a woman. Like it really was that I went through a traumatic event in my personal life and my body, and how I responded to it was that my ovaries started failing. So once I started hormone treatment, I swear it feels like somebody turned on the lights. Not living in the darkness anymore. I am myself again. My libido is up. I definitely am not a gym goer, but I can really say if I wanted to run a marathon, I know that I'm capable of training to run that marathon.
That's awesome.
A few years ago, I could never say that. Changed my life completely.
So speaking of trauma and hormones, can you maybe explain how when us women go through some traumatic experience, whether that's domestic violence or childhood trauma, how that can affect the hormones in your body?
Any sort of traumatic event, you end up going into what we call the stress response, right? So you are in this fight or flight mode almost on a constant basis. You're ready to fight whatever is happening in your life, or you're ready to run away. Okay. So what does that happen? Your cortisol levels go through the roof, right? Your adrenal glands, they get tired. Your testosterone gets wiped out because you've used it all up during this kind of stress response. So at the end, you're left a sad, deflated human being and just like no energy for life. Trauma can be emotional, it can be physical. I mean, really, it's I hate to say it, but it's all the same. The way that your body responds is all the same. And I have ladies who come to me after getting out of an abusive relationship, or they'll come to me after facing divorce or loss of a child, or just all of these traumatic events that can happen. And then they've dealt with it for years. It's not like the traumatic event happened yesterday.
It's still traumatizing them
over and over and over again. So by the time they come to me, they're just they feel so defeated. They're just like hanging on by a thread. When I see these women and I'm able to kind of encourage them and pick them up and give them a little bit of hope, like it's awesome. They leave here so, energized already just by talking to me because I'm passionate about it and I'm really dedicated to helping them. Then we do the blood work, and then I have them come back and I explain everything, and they're just like mind blown.
That blood work is the most thorough, best blood work I've ever got in my life.
It tells you such a big story, right? It's not just you are your trauma. No, unfortunately, that's not how it works, right? This is a result of the trauma. And you're able to kind of see the different parts of your body that it has affected, which is just wild.
And I think too, when you've been told over and over, your blood work looks good, you're fine, get some rest, go do some yoga. Literally, a doctor told me that. It's bittersweet because you don't want the blood work to be bad,
right?
But you want answers.
That makes me really sad to hear you say that because it happens so often. As women, we are told to be submissive and kind of be quiet and, when we do speak up about what we're feeling, oftentimes in the society we live in, we get dismissed. Like, oh, it's normal. It's normal for you to feel tired because you have 3 kids. It's normal for you not to sleep because you have a lot on your mind. Okay, but just because it's normal doesn't mean that we should be okay with it. My whole mission in helping women is I want them to like feel like their 29-year-old self again, you know?
Yeah.
And I want them to feel so like inspired and motivated. I have one patient, I love her to death, and she came here in the dumps, just like all my ladies come to me. And within like 3 months, she's like leading, like teaching Zumba.
That's
And I'm like,
amazing.
what is this? And she was not that person at all. And she just feels she's like dating again, like just all these things that she's kind of doing in her life that she never could do before because she just wasn't there, you know?
I know. It feels just so freeing when you can have somebody look at you and like they care. And it's almost like a cheerleader pumping you up and getting behind you and saying, you can do this and it's going to be okay. We're going to help you. We're going to get through this. So what are some of the hormones that are the main ones that we should be looking out for?
Yeah. So, you know, I deal with women who are not just like postmenopausal. I deal with a lot of perimenopausal. The way I like to describe it is like menopause is in this little room, right? So perimenopause, you're knocking on the door. So with perimenopause, is the majority of my clients actually is young women who are, you know, between the ages of like 30 and 50 who have had depleted testosterone mainly. A lot of times their estrogen is pretty okay. They're still having a cycle. But I think testosterone is the big one that I focus on with my premenopausal women. And of course, there's estrogen. You know, estrogen dominance is a really big thing. It can be debilitating for some. But sometimes early menopause, like myself, my body stopped producing estrogen altogether. So testosterone, estrogen is a big one. Progesterone, I mentioned to you, it is my favorite hormone. If I could put everybody on progesterone, I would, because it helps with anxiety, it helps you sleep, it helps with muscle and joint pain. Like it really has so many functions. Brain clarity. I mean, it's amazing. So those are the 3 main ones. And then I recently got trained in thyroid optimization, which is also a big deal. Thyroid hormones are hormones, you know, just like the female hormones. And they really affect a lot of other things as well, like energy, metabolism, you know, thermal regulation. Like what is that? Like temperature regulations. Like if you're walking around and your hands are always cold, that's not quite normal, even though we think it is. Sometimes getting you on the right hormone balance can kind of alleviate all of these symptoms. So those are the 4s that I mainly focus on.
You do bioidentical hormones. So when I went to the OBGYN, because I have something called adenomyosis, they put me on a birth control. And I never felt good about it. I didn't want to be on it. And come to find out, as you told me, it wasn't even helping the right hormones.
Right. So, you know, the difference between synthetic and bioidentical, there is a place for synthetic hormones in certain cases. It's not something that I do. I just don't like them personally. Bioidentical, the reason we call it that is because it's literally identical to what your body was producing. So we're not giving you anything fake. Does that make sense? Like we're not giving you chemicals. Like we're literally giving you something that's in the molecular structure is identical to what your body was producing. So it's not harmful to you. Okay. So the idea is that you're deficient in these hormones. So we're giving you what your body is unfortunately not capable of making anymore.
And that's true with the thyroid as well.
Exactly.
Because I'm on the thyroid T3. I'm going to remember all this progesterone, testosterone. It was a hot mess. And that's because of all the trauma I've been through. But it's also, I'm 38 years old. So I'm getting on to that age where
you're knocking on the door.
Yeah, I know. One thing about Carolina that I truly love is that she's passionate. And I'm passionate. And passionate people just love to get together and come up with ideas. And so one of the things that Carolina has in common with me is that she's so passionate about helping women. So can you tell me what it is that feeds that passion and why you got to that point? And also some of the results, which you've already talked about, but some of the things that you're truly seeing for every woman that walks through this door and how they're feeling and when they leave, how they're feeling.
I just feel like I've been called to help women. I don't like tearing down women. Like if I see that your business is thriving, I'm like the first one to be like, awesome. I'm so proud of you, you know, even in like the competitive arena, you know, like if it's another practice, like, you know, me and a friend kind of run this group for other nurse practitioners who have their own practice. And like, it's literally, we go there and we just encourage everybody because we're doing it. We're living the dream and we want other like new entrepreneurs to have that same experience. The thing that fills my cup the most, I think, is when I get feedback from my ladies, you know, a couple months in or even a month in where they're like, Carolina, I had the best night of sleep I've had in 20 years. And I'm like, what? Like, that blows my mind. I had another one recently who came in and she was telling me how, her libido was just non-existent. And, she was like, yeah, I see my husband and I'm like this. And I'm like, I get it. That's what happens. So now she's like, you gave me my marriage back.
Wow.
And I was like, oh, I was trying not to cry, but she said, she's like, we're like teenagers again. Like we actually like we're having intimacy on a different level because I want it now.
Yeah.
And so little things like that, like kind of empowering women to kind of embrace their sexuality again with their husbands is huge. Their self-esteem improves. The fact that they're confident to do these things. So I don't know. To me, it's just the most fulfilling thing. Every time I get one of those feedback, I'm like, oh, this is awesome. So that's why I love it.
And that's why I love doing Survivor Empowered, because it's about empowering survivors, but it's also showcasing we all have different passions and goals. And whatever you do in business, whether it's being in the medical field or if you're in marketing, you tend to have a passion that can help people. And so we have to never think that what we do is too small. Like, we can all make an impact. And that's why I love showcasing it. And it's definitely made an impact in my life. I can say that because it is so frustrating when you're not feeling well. And it was years and years of it. So to have this glimmer of hope that I can start to feel better, it means the world to me. So I am one of those people that she is talking about that walks in and walks out and feels great. So in the Tampa Bay area, you also do some amazing things with the underserved communities. I just want to share a little bit about that because it is important that we talk about that as well.
So the hormones is just kind of one facet of my business. So we run a primary care clinic. Our kind of target demographic are the uninsured, specifically the Hispanic community. Both my partner and I and all the staff is bilingual. So our focus really is to help those who are uninsured. Unfortunately, insurance is a hot mess. I know we love that word, but it is a hot mess and it's very expensive. Even through Marketplace, if you're like the middle class and you make a little bit of money, you don't qualify for some of the the government funding that helps with that. And then even when you have insurance, you have to pay deductibles and copays and all these things. So you end up paying all this money out of pocket. So what we offer is direct primary care. It's a monthly membership for primary care. People pay anywhere between $50 to $70 a month, and it's unlimited primary care. Like, if you need to be seen every week, you'll be seen every week. It includes your blood work. It includes follow-ups, urgent visits, direct access to one of the healthcare providers. So if you have a UTI on a Saturday morning, you don't have to rush to urgent care. You don't have to wait 2 weeks to get an appointment. Like, you can call us, we'll answer, or we'll see you on Monday and we'll make sure that you get seen. So that, in my particular demographic, like, it's really hard. They have a lot of trust issues when it comes to healthcare professionals because of the discrimination they've experienced. So to have a place that they feel safe, that their immigration status does not matter to us, that somebody speaks their language, that's everything to me. So that's really the heart and soul of our practice. And we just kind of expanded into hormones because, again, I saw another need and I could relate. And I was like, all right, let's do this, So it's just been awesome. God has been so good to us, and we're just very thankful.
You can definitely feel the spirit here. I think that it's important that you talk about the immigration. With domestic violence, it can come in immigration. It can come in financial abuse, where they won't let them get medical and all this. For people coming out of trauma, to be able to then have the means to say, hey, I have this issue. I've been abused in this way, but now I can come here and I can get the help I need. And it's a friendly, warm place for me when I've needed this so bad. I think that that's super important too.
And that's something we like, you've met my staff obviously now, but like, everybody is just really kind and welcoming. And like, when we choose staff to join our practice, like, it's really important that like we're just a family here, and we want our patients to feel like we know your name, but we don't just know your name. We know your husband's name. We know your dog's name. You know what I'm saying? Like, we want you to feel like this is a friendly place. This is not just, okay, come in, tell me about your diabetes, and that's it. Like, it's more than that. And that's why our appointments are longer. Like, your first appointment is not going to be 30 minutes. Like, it's going to be an hour or more.
And she does so much. She does weight loss. She does allergy stuff now. I mean, I could live here and probably be okay. I can just pull it back out and be like, give me all the things because I need it. Well, if you're in the Tampa Bay area, please come and visit Carolina and her whole staff at Vital Advanced Medical Center. It is in the Carrollwood area, and she can meet all your needs because she's got all the stuff. And so, Carolina, thank you so much for giving us all this education. Literally, I could have her on here for 2 hours talking about so many things. If you want to join me on my personal journey of trying to balance my hormones and lose weight, You can do that by watching my social media. Once again, thank you, Carolina.
You're welcome.